The author works locally at the Cairn Foundation, and that's Dr. David O'Connell, a psychologist there, and we're lucky enough to have him on the program, so thanks for being with us tonight, David. And we're going to be talking about this subject, the role of spirituality in healing and addictions, and how it relates to medicine. General question, what is spirituality? Very loaded question, I guess, but...
Well, spirituality, of course, encompasses a lot of different things, but let's take the word spirituality. It comes from the Latin spiritus, which means breath or breathing. And there's nothing more basic to life than breathing. Without it, life isn't sustained and we don't have life. So spirituality is really the basis of life. It's really the lifeblood of life, and could be conceived as the energy that's coursing through our bodies and coming from our souls. And spirituality encompasses a relationship with what we might call God or higher power, something beyond the physical. And it also encompasses spiritual practices, such as prayer and meditation. And spirituality is about cultivating a relationship with the transcendent, that which is beyond merely the physical aspects of life. And a lot of research has shown that cultivating that relationship, working a spiritual program, particularly with addictive diseases, can really have a great deal of health promoting effects, and particularly with healing effects with addictive diseases. So I would say that's what spirituality is. It really is something very basic and implies a relationship with something beyond the self.
Okay, and if you're just joining us, I forgot to mention our phone number is 610-378-0426. We would welcome your calls, comments, or questions about tonight's topic. When we're hearing about what spirituality is, I think one has to immediately say, well, isn't that religion? And what's the difference or the similarity between religion and spirituality? Are they one and the same?
There's a lot of similarities, but there are also some noticeable differences. Religion is always about spirituality, but spirituality, on the other hand, does not necessarily have to be about religion. Now, having said that, the word religion comes from a Latin word religio, and it simply means to relink or reconnect. So religion shares the same goal with spirituality in that it is about reconnecting, relinking, reforming a relationship with God or higher power, or higher self, if you will. And so in that sense, they're both the same. Where the differences come in is religion, when we think of organized religions, Judaism, Christianity, Buddhism, Islam, is a set of beliefs, a set of proscriptions, a set of thou shalts, if you will. And this can be divisive, and this can lead to differences among people. And as we've had this experience in the world. But really, spirituality and religion have a common goal, and that is liberation from suffering through relationship with God or higher power. And spirituality does not necessarily have to take the form of an organized or formal religious system.
Okay, so it sounds like the two are related, but they are distinct terms and have distinct meanings.
Exactly.
When your role as a psychologist at the Cairn Foundation, how did you get interested in this topic?
I got interested in spirituality. Well, I was raised Roman Catholic, and I came from a spiritual family where religion was emphasized and the spirituality associated with it. I got interested in spirituality by, when I was a junior in college, I started practicing a form of meditation known as TM, or Transcendental Meditation. And I found it very relaxing. I found it had great anti-anxiety effects. When I would go to take a test, my performance anxiety would lower, and I felt really good doing it, and I felt very practical benefits from it. And as I practiced it and the experiences grew, I became interested in finding out what great spiritual masters were saying about spirituality and the different systems of spirituality beyond Judeo-Christian systems. So I started studying world religions. I studied in England for a semester, and I had a course in world religions. So my own personal interest came from my own experiences and from my own spiritual practices. As a psychologist, when I started working in the field, I knew very little about addictions. For example, in my association with Cairn Foundation, I found out that the 12 steps of Alcoholics Anonymous were profoundly and primarily spiritual in nature, and that working a spiritual program is what is really the foundation for recovery in addictions. So I began to study 12-step spirituality. And within the 12 steps, they specifically mention that prayer and meditation, which are really, we could call them spiritual technologies, are essential in culturing and cultivating the nervous system so that one can maximize one's chances of getting a spiritual awakening, which is seen as essential for recovery from addictions. So it really came from personal experience, from being involved in the addictions field as a psychologist, talking to patients, talking to recovering counselors who themselves had a spiritual awakening, in which they described higher power coming into their lives and removing the compulsion and the obsession to use chemicals. So it had both practical and research and theoretical aspects to it. I didn't get a lot of preparation in spirituality as a psychologist. It's something that I had to learn along the way, and most recently studying medical journals and studying the over 1,500 empirical scientific studies, many of the medical studies, on the effects of spiritual practices on health. So that's how I sort of fell into it.
Okay, and we're going to talk about some of those studies in a minute, because I think they're very telling about the role of spirituality in the physical process. You had mentioned about the idea of the 12-step program, and some of our audience may not be familiar with that. Can you just talk, not necessarily list the 12 steps, but just give an overview. What is a 12-step program? What is that concept?
The 12 steps are a set of principles and procedures in a certain sequence that are designed to help somebody who is in the midst of an addiction, alcoholism, drug addiction, spending addiction, gambling addiction, face the fact that they are powerless over the addiction, that their lives are out of control and unmanageable, and it's a program designed to allow them to cultivate a spiritual awakening, to reach out for help beyond just their ego, beyond just their self, to the spirit, to the spiritual level of life, to the spiritual realm of life. And they're designed to liberate, in a very systematic way, someone from the bondage of addiction, from the constricting, obsessing aspects of an addictive disease, or any intractable chronic problem or condition.
Right. So it's like you're saying, a set of principles to help guide someone through the recovery process of an addiction, and along the way,
Exactly.
part of it is admitting that the addiction, are powerless over it in many respects, and that there is a higher power.
Right, principles and practices, because they specifically tell the recovering alcoholic or addict to pray, to meditate, to cleanse their soul, so to speak, by admitting wrongs they did during addiction. So there's steps that purify, steps that develop a deeper insight into the addict's personality, looking at such things as defects of character. And the whole purpose is to gravitate towards higher power, to have these impediments to self-realization, to liberation, removed. So that really is it really is a very interesting, very useful, universally effective system, founded somewhere in the 1930s, somewhere around the 1930s, and has been really the mainstay of addictions treatment for the past 7 years.
Alcoholics Anonymous and other organizations, that's a sort of a cornerstone.
Exactly.
12 steps.
Exactly.
One point, though, if spirituality is such a cornerstone of this idea of transcendence, and what do you say when people say, well, gee, I'm atheist or agnostic, or I don't know if I believe that? How does that play a part in this?
One can have the concept of higher power, which doesn't necessarily have to be theistic. It doesn't necessarily have to be a personal or impersonal experience of what we would call God. God is kind of a loaded concept, and it means a lot of different things to different people, and some people have negative associations to it. Somebody who is agnostic or atheist may have a conception of and a relationship to higher power that doesn't have to be God. It could be nature. It could be the energy that creates all of life. It could be something very intangible, even abstract. It could be the human spirit, the human tendency to bond together during adversity and help one another, and altruism. So whether or not somebody believes in a personal God or believes in an impersonal God, or it really has no interest in God, or it really doesn't have any belief in God, can benefit from really any spiritual program, but